Hello everyone, I am Dr. Gayathrik, consultant child psychiatrist at Maarga Mind Care. Today I thought I will talk to you about a child I had seen recently. This is in continuation to what we were speaking last time about how depression presents a little differently in children, right? So let's get into it, shall we? So this boy was a 14-year-old boy who came with his parents to see me. The complaints for which they came to see me were that there was a behavioral change in the boy. In the manner of child had difficulty in falling asleep, and the child was refusing to go to school, which was quite in contrast to how he usually was before. He was quite a regular child. They also told me that he would refuse to go in the morning, claiming that he had severe headache and it was stomachache one day, it was severe body pains. It would vary every day, as a reason that he would say that I don't feel like going to school today. They also noticed that he wasn't really doing things he used to like doing before, like maybe going out with his friends, playing football, which he was very interested in. So he was avoiding doing the things he usually liked doing before, and he was sort of cooped up in his own room, and he preferred to be aloof and withdraw. Whenever they would speak to him about it, he would snap back at them, and he would react in an irritable or angry fashion, which was quite in contrast again to his usual temperament. They found him to be quite easily irritable for even the slightest provocation or things these days. So these were the things that they noticed, along with decline in academic performance, which had been noted by the teacher and told to the parents. So they had brought him in for these complaints, and upon having a one-on-one chat with the boy, he told me about the fact that they had recently moved about a year ago from another place due to transfer of his parents' job, and he was finding the new place and the new school to be quite daunting. He was saying that there was a change in the curriculum, and he had not yet found his foot, if you can say, in this new place and new school. He said that though he understood that this was important for their careers, he would unwittingly blame his parents, as he felt that it is only because of them that he landed up in this situation, that he missed his friends and his old life from his old city and old school, and that nothing made him feel joy anymore, even playing football or going out with his friends. Or he had found friends, he said, but he would still often think about the friends he had in his old school and old place. There were times when he would wake up at 5 or 6 a.m. and would dread the fact that he needed to go to school, that he had to face the day. And then he said that it would make him feel nauseous, it would make him feel dizzy, it would make him feel very uncomfortable in his own body. And it resulted in him avoiding the whole thing about going to school, which naturally reflected in his grades as well, because he felt that he was not able to concentrate like before in his academics, that he was making more careless mistakes, that doing well in school just did not matter anymore to him. He even told me that there were days when he would lie awake at night in the bed, unable to fall asleep, and would often think about, I just wish all this was over. I wish I were dead, so to speak. That was quite an intense session that we had with the boy that day. But it also helped me gain a lot of insight into what was going on in his mind and what made him feel the way he did and the way he behaved. So he was subjected to some assessments from our end. We did psychometric testing, which included some instruments called scales. And we both, me and the psychologist we have at Maarga, we both diagnosed him with adjustment disorder, with a depressed mood. Now you see, the symptoms of depression that this child has shown is not very what we commonly see in adults. It presents more as somatic body pains, as refusal to go and play with friends, and irritability, where he was snapping back at his parents, and academic decline as well. So we spoke to the parents in detail, and we psychoeducated the parents about what could be the possible reason that he was behaving this way, and about the diagnosis as well. And we started him on both medication and therapy. medication which we gave him were antidepressants, which he needed briefly to help him cope and to engage in therapy, which we suggested as a cognitive behavioral therapy for the boy. So about 2 to 3 weeks later, that when he came to review with us, we noticed that there was significant improvement in his sleep, in his energy levels, his willingness to go to school and play with friends, so to speak. And we are looking forward to seeing him more, and I'm sure that we will see a lot of improvement in the coming reviews with him.